is the inflammation and infection of the membrane that surround brain and spinal cord. The meningitis can be caused by various organisms. First could be bacterial, that tends to be more severe. Second is a viral pathogen. It's more common in children and less severe. Third would be tuberculosis and other bacteria or parasite. Both can be caused by other non-infectious cause like some drugs or autoimmune malignancy. The severity generally is the infection of the nervous system is considered to be severe. It can cause fatal case. 1 in 6 patients may die, and 1 in 5 patients can have long-term disability from meningitis. The warning signs of meningitis includes high fever, headache, confusion, nausea, vomiting, light sensitivity, or weakness. The people who are at risk of meningitis depends on their underlying condition. Young children tends to be more susceptible to certain bacteria. That's why we have to keep immunization. And elderly patients and those with low immune are susceptible to certain bacteria and viruses. Also, those who live in the dorm or in the crowded environment are also susceptible to certain bacteria, especially the meningococcus that is now being endemic. Diagnosis of meningitis would include blood test to check for the blood count and culture. Second would be the imaging of the brain by the brain MRI or CT scan to evaluate for structural abnormalities. And third, the most important one, is the spinal fluid analysis that will be sent for culture and the test. The treatment depends on the etiology. The earlier, the better. The bacterial infection would require antibiotic treatment, plus or minus steroid treatment to reduce inflammation. Viral infection generally is self-limited. No treatment is required except for some certain virus that may be beneficial from antiviral treatment. For tuberculosis, a parasite depends on the etiology, so the doctors will give appropriate antimicrobial agents. Obviously, immunization is one of the key components of prevention. There are several vaccines against the bacterial pathogen causing meningitis. First is the pneumococcal vaccine. Second, meningococcal vaccines. For meningococcal vaccine, there are 2 types of vaccine against 5 strains. First, the vaccine against strain ACWY. Second, vaccine against B strain. These are recommended in those in adolescents and young adults who will reside in dormitory area or go to the crowded area. For those who plan to travel to the endemic area, I would advise you to consult the physician at the earliest possible to plan the vaccine, because it requires at least 10 to 14 days with the vaccine to cause immunity.